Welcome to the Omni Dental Podcast. Imagine brushing your teeth every single morning, looking in the mirror, and feeling confident that you are actively protecting your mouth.
Right, you're doing exactly what you're taught.
Exactly. You are using the leading brand, you're getting that thick, satisfying foam, and you just think you're doing a great job. Yet, in reality, that exact daily routine might be systematically stripping away your mouth's natural armor.
Yeah, leaving behind vulnerable tissue and basically inviting painful, gaping ulcers to form.
It's wild. It completely turns the standard morning routine on its head.
It really does. Because we place a tremendous amount of blind trust in everyday hygiene products. We just assume they keep the oral ecosystem perfectly balanced, when in some cases, the chemistry is doing the absolute opposite.
Which is why we are taking a radically different angle today for our deep dive. We are exploring the comprehensive clinical approach of OmniDental led by Dr. Bayless-Pols.
Oh yeah, they have a fascinating setup over there.
They really do. What fascinated me about studying their practice model is that they refuse to treat the mouth like, just an isolated cave floating in the middle of your face.
Right.
They treat it as the front line of your entire systemic health. And you see that holistic philosophy reflected heavily in how the clinic actually operates.
You do. Because they are physically based in Arlington Heights, Illinois, but they have essentially become a major clinical hub for an incredibly wide surrounding area.
Yeah, the footprint is massive.
Yep.
Patients are coming in from all over Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows.
Schaumburg, Wheeling, Des Plaines, Elk Grove Village. I mean, it's huge.
It is, and they draw from that massive area because they aren't just looking at individual teeth, they are looking at the whole patient.
Exactly.
Like I noticed they offer IV drip therapy right alongside complex dental surgeries or, a routine root canal. Plus, they feature this extensive aesthetic menu.
Oh, right, the aesthetic services.
Yeah, Botox, Sculptra, laser hair removal, permanent makeup. It's really a full-body perspective, blending cosmetic, general, and systemic wellness.
It makes total sense, though. A practice built on those systemic connections would obviously focus so intensely on demystifying a condition that, well, most people just brush off as a minor annoyance, which is the canker sore.
Yeah, but calling it a minor annoyance drastically undersells the biology of what is actually happening.
Oh, completely. It's way more complex. To understand the triggers, and specifically that toothpaste betrayal you mentioned earlier, we first have to define the biological event itself.
Right. Let's get into the anatomy.
So medically, a canker sore is known as an aphthous ulcer. And we must draw a firm, immovable line. Right now, this is absolutely not a cold sore.
I feel like making that distinction clear from the jump saves a lot of, late-night internet panic for people.
Oh, for sure.
Because when people hear the word sore on their mouth, they immediately assume they caught something. Like, cold sores are viral. You can pass them on by sharing a coffee cup.
Exactly. But an aphthous ulcer is completely non-contagious. You cannot spread it. What you are actually experiencing is a localized failure in the mucosal lining.
A failure in the lining.
Right. Because the skin inside your mouth is, well, it's like a high-speed cellular factory. It is shedding and rebuilding constantly. When that rebuilding process gets interrupted, the tissue breaks down, and a literal microscopic crater opens up.
That sounds intense. And there is a warning siren before the crater even appears, right? The dreaded prodrome phase?
Yes, the prodrome phase.
I know people who get these sores experience this hyper-localized burning or tingling, like a full 24 hours before anything is actually visible in the mirror. What is happening under the surface to trigger that alarm?
So your sensory nerves are firing because the tissue is beginning to break down at a cellular level.
Okay.
The body senses the vulnerability, and the inflammatory response rushes white blood cells to the area. That creates a microscopic swelling beneath the surface layer.
Wow, so it's already swelling before you see it.
Yeah. The pressure of that fluid swelling pushes against the highly sensitive nerve endings in your cheek or lip, and that's what creates that distinct tingling sensation.
Then the surface layer gives way and you get that classic visual. A shallow ulcer with an angry red border and a white or yellow center.
That's the one.
But not all of these craters are created equal, are they? They fall into 3 distinct tiers. Let's start with minor canker sores, which account for about 80% of all outbreaks.
Right. Minor sores are defined as being under 10 millimeters in diameter, and they typically heal in 1 to 2 weeks.
Okay, so relatively fast.
Yeah, the reason they heal relatively quickly is that the damage is confined to the uppermost layer of the mucosal tissue. The cellular factory just needs to patch the surface epithelium.
So it's basically like a minor sore is essentially a cellular pothole.
A plot hole, exactly.
The crew comes in, pours some fresh asphalt, and you move on with your life without any permanent damage. It's like a stubbed toe. Annoying, but fine.
That's a perfect analogy.
Mm-hmm.
But then we hit tier 2, which are major canker sores. These are larger than 10 millimeters, but it isn't just the width that changes. It is the depth.
The depth. Ouch.
Yeah, they dig aggressively deeper into the submucosa, which is the underlying connective tissue. This is where the pain level spikes exponentially.
I can imagine.
It makes basic functions like speaking or chewing agonizing. And the healing timeline stretches out dramatically, sometimes taking up to 6 weeks.
6 weeks of that. That's like a terrible uninvited house guest that just won't leave. And the documentation also notes that major sores can leave a scar inside your mouth.
Yes, they can.
I have to push back on that conceptually a bit because the mouth heals so incredibly fast. It's a wet, highly vascular environment. How does it manage to form a permanent scar?
It's a good question. It happens because the damage bypasses the surface cells. When the ulcer destroys that deeper connective layer, standard epithelial cells just aren't enough to fix it.
So the pothole crow isn't equipped for it.
Exactly. The body has to deploy fibroblasts, which lay down dense, thick collagen to bridge the structural gap. That dense collagen patch is what we recognize as scar tissue.
Wow. Okay, so using our analogy, if a minor sore is a pothole, a major sore is like a sinkhole that destroyed the plumbing lines underneath. It requires a completely new foundation.
Precisely. And then there's tier 3, and honestly, the name alone feels like a cruel joke. Herpetiform canker sores.
Yeah, the naming conventions in medicine can be incredibly frustrating. Despite having herpety in the title, we have to reiterate, they have zero connection to the herpes virus.
Zero. The name simply describes the visual presentation. But they are terrifying.
Terrifying is the right word. Instead of one distinct crater, you get a cluster of up to 100 tiny pinhead-sized ulcers.
Yeah, it's brutal.
And if that isn't punishing enough, those dozens of tiny micro-ulcers can necrotize at the edges and actually merge together into one massive, jagged super sore. It's like the Voltron of pain.
It really is a devastating inflammatory cascade.
Right.
Instead of a single isolated breakdown, the entire local network of tissue suffers a coordinated collapse.
It is a microscopic villain.
Yeah.
So now that we understand the anatomy of the ulcer and what tier we might be dealing with, we have to ask the most important question. Why does the tissue collapse in the first place? What summons the villain?
Well, we can start with mechanical triggers. Physical trauma is a major catalyst.
Like what?
Like accidentally biting your cheek while chewing, brushing too aggressively, or the constant friction from the rough edge of a dental appliance like braces.
Right, that makes sense. That physical trauma literally tears the protective layer, giving the ulcer an opening.
Exactly.
But there are also massive internal triggers, specifically emotional stress and chronic sleep deprivation. Why does a stressful week at the office literally result in a hole burning into my cheek?
It all comes down to chemical resource allocation. Chronic stress floods your system with the hormone cortisol.
Cortisol, right.
And while cortisol is great for a short-term fight-or-flight response, chronic elevated levels severely suppress your immune system.
Oh, I see.
Your body decides that maintaining the delicate mucosal lining of your mouth is, a low priority compared to keeping your heart rate and muscles primed for whatever is stressing you out.
Wow. So the body just diverts the repair crew away from the mouth entirely to deal with the perceived crisis.
Yes, exactly.
So when you inevitably experience a micro tear in your cheek, there are no immune resources available to patch it. The inflammatory response just runs unchecked.
That unchecked vulnerability also makes you highly susceptible to dietary triggers. Highly acidic foods, things like citrus fruits, tomatoes, heavy vinaigrettes, they're notorious for this.
Really? Just from the acid?
Yeah, the citric or acetic acid alters the local pH of the mouth. This causes protein denaturation in those exposed vulnerable cells, effectively burning them away.
Which brings us directly back to the hook of our deep dive, the toothpaste betrayal.
Yes.
I need to unpack this because sodium lauryl sulfate, or SLS, is a fundamental ingredient in almost every household cleaner. I mean, it is in my shampoo, it is in my dish soap. Are you telling me the industry uses a heavy industrial chemical in my mouth and it actively causes ulcers?
It is heavily utilized because consumer psychology basically dictates it.
What do you mean?
Over the decades, we have been conditioned to associate thick, billowing foam with cleanliness. SLS is a powerful surfactant. It lowers the surface tension of the liquid, creating that massive lather we all love.
Right, the satisfying foam.
But the underlying issue is that for a significant percentage of the population, that chemical surfactant is simply too aggressive for the oral mucosa.
Oh man, so think of the mucin layer in your mouth like the protective wax coating on your car. Brushing with an SLS-heavy toothpaste is like washing your car with harsh industrial degreaser. It completely strips the wax off the paint.
That is a phenomenal visual.
Yes.
Once that mucin layer is stripped away by the SLS, the underlying tissue is entirely exposed. If you then introduce something highly acidic, like a tomato sauce at dinner, that acid has direct, unimpeded access to the vulnerable cells.
Wait, so the spaghetti sauce isn't the root cause. The spaghetti sauce is just taking advantage of the door your toothpaste blew wide open.
Exactly.
Yeah.
The toothpaste is the accomplice.
That is a massive paradigm shift for anyone suffering from these. I feel so betrayed by my morning routine now.
It really changes how you look at the oral care aisle.
Definitely. But let's look at the bigger systemic picture for a second. Let's say you throw away the SLS toothpaste, you manage your stress, you sleep 8 hours a night, and you are still getting these outbreaks more than 4 times a year.
Well, that frequency changes the entire diagnostic landscape.
Yeah.
At that point, the mouth stops being the victim of local trauma and starts acting as an early warning dashboard for the rest of your body.
Like the check engine light for your internal organs.
Precisely. Because the oral mucosa turns over so rapidly, replacing itself constantly, it requires a massive, uninterrupted supply of raw building materials. Specifically, the body needs vitamin B12, folic acid, and iron.
Why those 3 specifically? What do they do in the cellular factory?
They are the absolute foundational elements for DNA synthesis and red blood cell production.
Okay.
When a cell divides to replace the shed surface cells of your cheek, it must replicate its DNA perfectly. If you are deficient in B12 or folic acid, that replication process slows down drastically.
So the high-speed factory in your mouth simply runs out of bricks. The barrier thins out and the walls collapse into ulcers.
Yes. Furthermore, we have to view the human body anatomically here. The digestive tract is one long, continuous tube starting at your mouth and ending at your intestines.
Right.
If you are suffering from an inflammatory bowel disease like Crohn's or an autoimmune reaction like celiac disease, the resulting inflammation isn't neatly contained in your lower gut.
The inflammation travels all the way up the pipe.
It does. The canker sore might actually be the very first visible symptom of deep-seated gastrointestinal distress. The immune system is misfiring along the entire tract, and the mouth is simply the only part of that tract you can easily see in a mirror.
Wow, that completely changes the urgency of the situation. It elevates a mouth sore from a localized annoyance to a systemic red flag.
It really does. You shouldn't ignore it if it's recurrent.
Let's pivot to the tactical response then. We need to move from diagnosis to immediate action, starting at the bathroom sink and ending in the dental chair. If a listener has a painful ulcer right now, what is the immediate biological intervention they can do at home?
The first line of defense is shockingly simple, but chemically profound. A saltwater rinse.
Just salt and water?
Yep, the precise ratio is 1 teaspoon of salt dissolved in 8 ounces of warm water.
I want to focus on the mechanism here because a lot of people dismiss salt water as like an old wives' tale and they reach for a commercial alcohol-based mouthwash instead. Why does salt actually outperform the chemical burn of alcohol?
It operates on the principle of osmosis.
Osmosis. Okay, take me back to high school biology.
Right. So the tissue surrounding the ulcer is heavily inflamed, meaning it is packed with excess fluid pressing outward against your nerve endings. Salt water is a hypertonic solution.
Meaning it has a higher concentration of salt than the cells do?
Exactly. When you bathe the sore in it, the high salt concentration outside the cell actively draws the excess fluid out of the swollen tissue to balance the ratio.
That's brilliant. Less fluid inside the tissue means less physical pressure on the nerve, which results in an immediate reduction in pain. It is pure mechanical physics.
It really is.
We also have over-the-counter numbing gels that feature benzocaine, but I don't know, those always feel incredibly temporary. You put it on and 5 minutes later you just swallow it.
Yeah, that's the catch. Benzocaine acts as a localized block on the sodium channels in your nerve endings, which temporarily stops the pain signal from traveling to your brain. However, you are applying it in a wet, highly mobile environment. The saliva washes it away quickly. So the strategic use of benzocaine isn't to cure the sore, it is to grant you a 30-minute window of numbness so you can successfully eat a meal or give a presentation without wincing.
That makes sense. Applying a simple piece of ice accomplishes something similar, right? But through a different mechanism.
Correct.
Yeah.
Instead of a chemical block, the extreme cold forces vasoconstriction.
It shrinks the blood vessels.
Yes, it physically shrinks the blood vessels in the area, reducing the blood flow and the swelling, which pulls pressure off those overactive nerves.
While managing the pain is crucial, long-term prevention requires mechanical changes too. And upgrading to a soft, bristled toothbrush is absolutely non-negotiable.
Oh, totally non-negotiable.
Because dragging stiff, hard bristles across an open ulcer is essentially taking rough sandpaper to a fresh sunburn. You are violently tearing down whatever fragile granulation tissue the body just managed to build.
That's exactly what's happening. We must preserve that delicate scaffolding. Soft bristles effectively clean the enamel without creating the microabrasions in the soft tissue that inevitably turn into tomorrow's ulcers.
So we have the at-home chemistry and the mechanical prevention. But there comes a definitive point where playing bathroom scientist isn't enough. When do we need to call Dr. Poles and the comprehensive care team at Omni Dental? What are the strict clinical red flags?
The primary metric is the timeline. The 3-week rule is paramount.
3 weeks.
A relatively healthy immune system is highly efficient. It should be able to close a standard mucosal wound within 21 days. If that sore is still open on day 22, the healing process is fundamentally stalled, and you require professional intervention.
What other red flags should trigger a clinic visit before that 3-week mark?
Definitely crossing into that major or herpetiform size category where the extreme pain is severely impacting your daily life. And developing a fever alongside the sores is a critical warning sign.
A fever.
Yeah, a fever indicates that the local inflammation has provoked a systemic immune response, or that a secondary bacterial infection has taken hold inside the open wound.
Wow, okay. The sources also highlight difficulty swallowing. If the ulcers are extending far down the throat or causing so much severe inflammation that swallowing food or water is impaired, that immediately becomes a medical priority.
Absolutely. High recurrence rates also demand attention.
Right.
If you change your toothpaste, adjust your diet, manage your stress, and you are still experiencing frequent outbreaks, an underlying systemic condition just must be ruled out by a professional.
So let's assume a listener hits that 3-week red flag. They walk into the clinic in Arlington Heights. I think a lot of people cynically assume a dentist will just look at it, shrug, and tell them to wait it out. What actual aggressive chemical interventions can a modern practice deploy?
Well, a well-equipped clinic has powerful prescription tools to override a stalled healing process. For severe cases, they rely on topical corticosteroid pastes.
Applying a steroid directly inside the mouth, is that safe?
It is a highly targeted application. A severe canker sore is essentially your immune system overreacting, dumping inflammatory cytokines into the area, and inadvertently destroying its own tissue.
Like friendly fire.
Exactly. A topical steroid forces those local immune cells to stand down. It forcibly shuts off the inflammatory cascade, which finally allows the cellular repair mechanisms to outpace the tissue destruction.
You are chemically dictating that the body stops fighting itself. That's incredible. They also utilize tetracycline-based mouth rinses, which I usually associate tetracycline with clearing up severe bacterial infections.
It is a potent antibiotic, yes, but in this specific application, we exploit a secondary characteristic. Tetracycline actively inhibits the specific enzymes that break down collagen.
Oh, wow.
So it stops the crater from digging deeper into the tissue while simultaneously clearing out any opportunistic bacteria. It gives the ulcer a pristine, sterile environment to close up in.
That is the difference between hoping it gets better and actively managing the biology of the mouth. Okay, let's pull all of this together and build the ultimate cheat sheet for anyone dealing with this right now. Number 1, take a deep breath. Canker sores are aphthous ulcers. They are not contagious. You do not have a viral infection.
Right. Number 2, audit your daily environment. Are you in a period of high stress? Are you flooding the delicate tissue with highly acidic foods? And most importantly, walk into your bathroom and check your toothpaste label.
The betrayal.
Yes. If you see sodium lauryl sulfate listed, throw the tube in the trash immediately.
Number 3, leverage mechanical physics. Use a warm saltwater rinse to actively pull inflammatory fluid out of the tissue via osmosis, and switch to a soft bristled brush to stop destroying your mouth's natural repair scaffolding.
And number 4, respect the clinical red flags. If a sore remains open past the 21-day mark, if it causes a fever, or if the outbreaks are relentless, seek professional evaluation. Whether you reach out to the comprehensive team at Omni Dental in Illinois or your local provider, do not ignore a stalled wound.
Which brings me to a final, somewhat provocative thought I want to leave everyone with today. We began this deep dive viewing canker sores as, a random isolated punishment for accidentally biting a cheek,
Right.
but discovering how they actually serve as an early warning system, a flare signal for everything from a B12 deficiency stalling cellular reproduction to the creeping inflammation of Crohn's disease, forces a massive shift in perspective.
It really does.
It really leaves you wondering what other subtle, seemingly minor signals is the complex ecosystem of your mouth actively broadcasting about the hidden health of your entire body, long before a standard medical blood test ever catches it.
It completely redefines the concept of a routine dental checkup.
Yeah.
The mouth is an incredibly articulate communicator, and it might just be the clearest diagnostic window into the body we possess.
A brilliant place to pause. Keep paying attention to the signals your body is sending, and we will catch you on the next deep dive.